Vectorial analysis of heart. Today I will explain about the vectorial analysis of the normal ECG. From the last class, we have come to know about the cardiac impulse transmission through the heart. Thus, it is obvious that any change in the pattern of the transmission can cause abnormal electrical potentials around the heart. Consequently, this will alter the shape of the waves in the electrocardiogram or ECG. For this reason, most serious abnormalities of the heart muscles can be diagnosed by analyzing the contours of the waves in different electrocardiographic leads. So, this is the normal ECG and this is P wave showing atrial depolarization. This is QRS complex and this is T wave. Again, this is P, QRS and T wave. So this is the normal electrocardiogram. Now we will study the vectorial analysis, how these vectorial analysis will indicate how these waves occur and why they are of this shape. Now, so as to understand vectorial analysis, we have to know about the principles of the vectorial analysis. To understand how cardiac abnormalities affect the contours of the ECG, one must first become familiar with the concept of vectors and vectorial analysis. Vector is an arrow that points in the direction of the electrical potential generated by the current flow, with the arrowhead pointing towards the positive direction, and the length of the arrow is drawn proportional to the now resultant vector is in the heart at any given instant. So this is basically the vector. Now, the instant of heart excitation, electrical current flow between the depolarized area inside the heart and the non-depolarized area on the outside of the heart. Some current also flows through the heart chambers directly from the depolarized area towards the still polarized area. So, this is the vector and it denotes the flow of current from the depolarized area to the still polarized. Now let us come to axis for each standard bipolar leads. Each lead is actually a pair of electrodes connected to the body on the opposite sides of the heart. The direction from the negative electrode to positive electrode is called the axis of the lead. Thus, lead 1 is recorded from two electrodes respectively on two arms. As the electrodes lie exactly in the horizontal direction with positive electrode on the left hand, the axis of the lead is taken as 0. Now, uh, so uh, thus we see that this is all about the vectorial analysis of the normal electrocardiogram. P wave denotes the atrial depolarization and is recorded positively in electrocardiogram. QRS wave is formed of three waves Q, R and S, and they denote ventricular depolarization wave, and T wave which we see in the ECG is basically the ventricular repolarization wave, which is positive in nature and it is above the zero line.